Manual therapy interventions are used in the management of musculoskeletal conditions, and they're a common recommendation in clinical guidelines. However, its use in some areas of musculoskeletal practice is controversial in some sectors of our profession. This may be because, historically, manual therapy was built on the principles of anatomical reasoning and technical specificity. In this short presentation, I will present an alternative view to how manual therapy can be integrated into clinical practice using our current understanding of pain science and also exercise prescription. But first, it's worth starting with the basics and establishing the main goals of physiotherapy, which is to restore, maintain, and maximize a patient's physical function, mobility, and overall well-being. This is achieved through various techniques aimed at relieving pain, improving movement, strength, coordination, and preventing future injuries or disabilities. So based upon these goals, it's worth exploring what all our physiotherapy interventions consist of, to provide both a theoretical, but also consequently a clinical basis for our practice as physiotherapists. Because let's be honest, when you think about it, all of our interventions either involve the application of force, the transfer of force, or the generation of force. So force is important. But how do we use force to help our patients when we use manual therapy? Firstly, we need to understand two important concepts that unify our profession. The first one is mechanotransduction. Mechanotransduction in physical therapy refers to the process where cells in the body convert mechanical forces like those applied during exercise or manual therapy into cellular and biochemical signals that promote tissue repair and also remodeling. Essentially, it's how our bodies respond to physical stress by making changes at the cellular level to adapt and heal. Then we have the neurophysiology of pain and nervous system function. Manual therapy can affect the nervous system's response to both pain in the peripheral nervous system and also the central nervous systems. Manual therapy, which requires the application of force to soft tissues and joints, can stimulate the release of pain-relieving substances like endorphins and also modulate pain signals. There's increasing research to suggest that manual therapy can alter the way pain is processed in the brain, potentially reducing the perception of pain. But what about our principles of treatment? So with manual therapy, we are focused on the application of force to a joint to affect mechanical transduction and also the neurobiological mechanisms which modulate pain. But it's important to remember that when we apply a treatment to a joint, the force we impart to that joint affects all the tissues in that local area. Take, for example, a PA glide to the head of the fibula. It will primarily affect that joint because that's where we're dumping most of our forces. But the force will also affect the local soft tissues close by, like the common peroneal nerve, the lateral collateral ligament, the biceps femoris tendon. So there is no pure treatment of joints. Now, some of you listening to this will probably manage more chronic or persistent patient problems than acute problems. And so you may not see the relevance of manual therapy to your practice. So how can we use it in a clinically reasoned way with chronic presentations? The best way to think about it is manual therapy simply provides a window of opportunity to you and the patient so the patient can participate in therapeutic exercise. A classic example is when a patient presents with a painful movement impairment in which hypermobility of either the muscle overlying a joint or the joint itself is contributing to a painful movement pattern. For example, the patient that presents with a 6-week history of neck pain and stiffness, which is driven by a muscle or joint impairment. Manual therapy can allow the conditions for therapeutic exercise to take place via the modulation of pain. Now manual therapy, it's a broad church, and it encompasses any hands-on treatment that involves you as the therapist applying force to the patient using your body, normally your hands. So under this definition, it would include interventions such as massage, fascial release, joint mobilizations, passive movements, high velocity, low amplitude manipulations. All manual therapies work on the same principle, the application of force, typically a pushing force to a joint and its associated soft tissues. So things like the direction of force and the amount of force probably don't matter. What really matters most is your communication with that patient before, during, and after the treatment. The patient's comfort during the procedure, and theirs and your safety. So beyond these 4 factors of force, communication, safety, not much else matters. So in conclusion, manual therapy is fundamentally just the application of tissues or force to tissues, be that joint, muscle, ligament, or nerve tissue. It's used to improve functional movement by providing the patient with a window of opportunity to undertake therapeutic exercise so that the patient can return back to their sport, their occupation, or activities of daily living.